Thank you so much for joining Kent V. Hasen, MD, Anesthetic Plastic Surgery and Med Spa of Naples for our first ever Ellacor virtual event. We want to encourage you to stay till the end of the presentation today for a question and answer session with Dr. Hasen. And I also want to tell you about our special that we are offering today only, which is buy 2 Ellacor treatments and get 1 treatment free. We also have some wonderful drawings that we're going to do. The first prize is 1 full syringe of Restylane, and the winner can choose between Refine, Define, and Kiss. The second prize drawing is going to be 40 units of Botox. And the third prize drawing is a hydrofacial and complimentary consultation with our medical esthetician.
Ellacor is a new treatment that we offer at Aesthetic Plastic Surgery and Med Spa of Naples. And we're excited about it because it's a first-in-class type treatment that uses microcoring technology. What makes Ellacor unique among all the other different options for non-surgical facial rejuvenation is that Ellacor does microcoring. So what it does is actually remove skin with no surgery and no scarring. And it doesn't use any heat or laser energy, so there's no collateral damage to your skin. So who's a good candidate for Ellacor? Well, that's pretty much anybody. I mean, the best patients would probably be ones that don't need a facelift, but are looking to get some tightening and improvement in the fine lines and wrinkles, as well as the texture of the skin and also some of the looseness. So people with just early jowling and maybe some fine lines. So probably the ideal candidate would be someone in their 40s and 50s, but patients of all ages could benefit from it. We're often asked, what is the downtime with Ellacor? And while every patient is different, the downtime is probably somewhere in the 1 to 2 week period. It's after a couple days, patients can actually start wearing cover-up makeup. The problem with it is that there is going to be redness and kind of track marks from the actual treatment, and you need to cover that up with some cover-up makeup. Typically, like a green tinted moisturizer really does a great job of covering it. So patients are very socially acceptable, I'd say at 1 week, but it's really probably about 2 weeks before they feel completely comfortable outside. So just after the treatment, we apply a CO2 lift mask, and that's also used then daily for 3 days after this procedure. That really helps with the hydration. So after the procedure, there's really no pain. There's definitely swelling, the redness that I had already mentioned, as well as possible bruising. But all of that can be covered up after about 3 days when the patient's skin is really healed. Hi, and this is Bethany. Bethany is a patient that we've treated with Ellacor, and she's actually had 2 treatments. Bethany, can you tell us a little bit what attracted you to getting Ellacor treatment versus other treatments, as well as what were you hoping to accomplish?
So what I liked about the Ellacor was that I wasn't ready for a facelift or lower neck lift. And the Ellacor being that it doesn't add scarring and the downtime is relatively quick to recover from. I wanted to take care of some of my jowling, some fine lines and wrinkles, and just to see if we could get everything a little bit tighter to make me look more youthful in my appearance.
Good. And do you feel like after 2 treatments, you're about 2 months out from that at this point,
60
right?
days. Mm-hmm.
So after the second treatment and 60 days out, do you feel like that you have achieved some of those goals, and are you still seeing improvements?
Definitely still seeing improvement in the skin. My skin is starting to return to normal from the dryness, and I'm definitely seeing less wrinkles around my mouth, and my jawline is actually looking much more defined already.
That's great. And so would you have any tips for patients that may undergo this procedure?
To definitely consider doing this procedure. I think it's completely worth it. And it could take anywhere from 2 to 3 treatments possibly that your surgeon would recommend. I do think it's a wonderful procedure, and you do have to trust the process of recovery.
Thank you so much for joining us today for this Ellacor virtual event. We hope you enjoyed it as much as we did. Make sure that you do check your emails. That is how we will be notifying you if you are a winner of one of our wonderful giveaways. Please be sure to text back yes. That is how you will be able to be contacted so that we can schedule you for a wonderful consultation with us for this Ellacor treatment. And you may now go ahead and submit all of your questions to Dr. Hasen over the next 15 to 20 minutes so that we can answer those questions live with you right now. So we look forward to speaking with you. Hope you have a great day.
Hi, and thanks everybody for joining us on this webinar. And I see that there's already some questions, so I'll go ahead and start answering some of those. There's a question asking kind of how much does it cost? And that depends on kind of the areas being treated. The FDA approval for treatment's really kind of in the lower part of the face. And so that's treating across there and through the mouth. The FDA approval was for 3 treatments, spaced at least 1 month apart. However, many patients do well with even just 2 treatments. So typically we either have you just buy 2 treatments and then possibly use a 3rd one later. And in fact, one of our specials today is that if you buy 2 treatments, you do get that 3rd one later for free. So that's good. And then also don't forget that we do have a raffle, and that will be done, I believe, tomorrow. But for everybody that's attended the seminar, the top prize of that will be 1 syringe of Restylane, and that could be either Kiss, which is used for the lips, Define, or Refine, or even Wrestling Contour. Also, second prize is 40 units of Botox, and that's basically used for wrinkles and fine lines in the forehead, the glabella, which is between your brows, and crow's feet. And then finally, hydrofacial, which is a really nice facial that's done with this machine by our esthetician, and a free skin consult. So first, if you see there's this question here, so just please answer the question and we'll move on from there. All right. And can you still use, somebody asked if you could still use facial fillers after the treatment. Yes, you can use facial fillers afterwards. However, facial fillers right before the treatment, it's not really advised because these cores go through the skin and actually take out pieces of the skin. And that's how it then gets the contraction and improvement of the fine lines and wrinkles. So it's going deep enough to go through and actually extrude out some of the filler. It's not that that's a big deal. It's just that you're not going to get your full benefit from the filler that was placed in the area. It asked also, somebody asked how many treatments would an average, late 50-year-old patient need? And typically that'd be between 2 and 3 treatments. What we found is that there's different levels of the density that we can treat with the Ellacor. So you can either be very aggressive or you can be less aggressive with a little less downtime. And what we found is that the little less aggressive with less downtime actually does very well. And so patients tend to like that a little bit better. You kind of get back to not being quite as red and quite as noticeably after a treatment much quicker. And that way, then just doing 2 treatments with that, or possibly 3 treatments with that, will still get you a really great result. Yes, there's a question that patients were asking, well, yes, we understand that it's FDA approved through here, but will it help in the neck area as well? Well, that's considered off-label, but we definitely do treat into that area as well. So we treat below the neck and down into kind of the lower part of the neck area. In fact, it's being used off-label in other areas of the body. So off-label means that it has an indication, as I said, an indication in the face area. However, when it's off-label, a doctor can use it in other areas, although it's not truly FDA approved there. So areas that are being treated with that are even frown lines in the forehead, in the temple area, the neck, as I had said, but also off face areas like the abdomen, above the knees. It's been really a lot of, I haven't done that yet, but we're starting to have our first few patients that are going to have treatments above the knees. And okay, I'm sorry. I think I lost connection there. Now, I was talking about different areas of treatment, and the last area I was talking about was above the knees. And in that area, again, that would be probably a 2 to 3 treatment session, and patients have expressed a lot of improvement in those areas. One question said, does this leave red dots all over your face? And it does initially. The first few days, it basically looks like track marks, almost like you were run over by a radial tire or something. However, that is, after about 3 days, those holes have all shrunk and contracted and healed. So at that point, you're just pretty red with kind of these dots on the face, but you can cover up after about 4 days to 7 days with a cover-up makeup, and usually using kind of a green tinted makeup. cover up, that really helps get rid of that redness look. There was a question if the treatment is permanent. Well, nothing's really permanent. It permanently is removing those cores of skin. Each treatment, we're removing anywhere from 1% of the skin of the areas that's being treated up to 8%. 8% again is that very aggressive treatment. So we're doing more in the 5 to 7 range on our treatments. But if you do that 3 times, you're removing about 15% of the skin in this area. So you can imagine the tightening effect that you'll get with that. How does this compare to Morpheus 8 or other RF treatments? And that's a great question, actually. So this is a totally different treatment. We offer Morpheus 8 as well. Morpheus 8 is a microneedling. So microneedles are solid needles that go through the skin and create punctures to the skin. And then Morpheus also includes radio frequency, which is heat energy. So it goes in, creates the microneedling, but then at the bottom of that, through the needle, it transmits heat into that area to cause a reaction. So that causes a thermal damage, and that's a controlled thermal damage. And you want that in that setting because you're trying to get some regeneration of collagen. This is totally different in the fact that it's using hollow needles that are on suction. So the hollow needles go in, they penetrate down, and they actually core out that little piece of skin and gets sucked back into the machine. And those areas then are little holes in your skin. And it just takes a couple days for your skin to contract and heal with no scarring. So the difference, though, is that there's no energy use. So there's no damage to any of the other tissue around it. So it's only affecting the skin, and it goes down into the subcutaneous fat below the skin. So I would kind of say that it is like microneedling on steroids in the fact that it's, not just needling, but it's actually coring out. So we call it microcoring. Can it be used above the lip? And yes, we treat, as I was saying, kind of along the cheek line down, across, right underneath the nose, all the way down onto the lip. And that helps with some of the lip lines and treatment. And then the lower lip, we treat right onto the lip itself and then down the entire chin. And then when we come into the neck, which we use almost in every case, we come down pretty low just to get all that wrinkles through the skin area. The treatment itself probably takes about a half hour to numb. Oh, and that was another question is asked, how is this done? Is it done just, with patients just coming in and we do it, or but we don't because it would be painful. As you can imagine, we're penetrating through the skin, cutting the skin and pulling that skin out through these needles. So we do a numbing. First, we apply a topical numbing cream, and then we use what's called mesotherapy needles, which are these tiny little like 1/4-inch needles that go in on and they're very small, 32 gauge, which is like the smallest gauge needle used. We do little blebs all across the face, any area that we're treating, and that allows it to numb. And then it's all kind of numbed up, and then we do the procedure. Let me see. There's other questions. And thanks so much for all these questions. They're really great. Oh, somebody asked about the cost, and the cost of it is variable. As I was saying, it depends on what area is being treated. We can do just the cheek to jowl, and that tends to be around $3,200 for a treatment. If we do multiple treatments, that's when you would get the discount. So if we were doing 3 treatments of that today, that would then be more like $6,500 because you get that 3rd treatment free. Somebody asked if after the initial consultation, would you be able to determine how many treatments would be required, thus give you a pretty good idea of the cost? And for the most part, yes, but everybody could, continue on and say, oh, okay, well, 2 treatments was good, but maybe I want to have a third one, or I want to have a fourth one. It could be done also down the road. So I think that many patients might do 2 or 3 treatments at the beginning, and then maybe on a yearly basis have a single treatment to kind of maintain those results. Somebody asked how far apart are the treatments, and again, that would be about at least 1 month between. Now, as I said, patients can have that red mark kind of where each individual treatment square was. And sometimes that can last for a couple of weeks, and sometimes even out to a month. At times, it could be treated with a vascular laser like we have here, XLV, and it helps get some of that redness out. But another great way to do that, to get rid of that, or to at least blend it, is to do a second treatment. And in the second treatment, the squares will not be in the same lines, and thus it will just fade more evenly. So it will just look more evenly red rather than actually having squares. There was a question about any restrictions after a treatment session, like flying or exercising. And I would say that initially you just wouldn't want to really probably work out for the first like 3 to 4 days, because again, those pores they're still healing and they're sealing up, and it's quite red. So that would be the biggest thing with that. And another question was, why would we bring Ellacor into our practice? And it's exactly that reason, is that I think it is something that is brand new, and it makes a lot of sense. It was actually created by a few dermatologists who have made other really great inventions, including cool sculpting. They're based out of Harvard. And the idea was that by microcoring, what they did is over years figured out what's the biggest size holes that they could do for the cores, and that it could still heal with no scarring. And what they found is that this machine at this level, these holes are what get you to the most safe but also effective way. All right. One question is saying, would you consider this the next best thing to a lower facelift? And I think that it definitely is a viable option to get some improvement with that. It's definitely not going to be quite as strong because, again, it's not rearranging the deeper tissues like the muscles. So if patients have bands of muscle hanging down, it's not really going to address that. It's just going to help tighten up the skin. But I do think that it's probably more effective than other non-surgical treatments for sure. The aftercare for this treatment is basically, we do these CO2 masks, which are kind of a nice cooling mask that you put on your face. And what that does is helps with the oxygenation of the tissue. And then after that, you just use Aquaphor. And after a few days, then just any kind of mild moisturizer. Another question was, can it be done on the inner arms? And that too is another area that's off-label, but certainly is being looked at, and we're starting to get some patients that are interested in being treated in that area as well. And there's a question about also, is the procedure painful? And as I was saying, it's not painful if it's numb. So the numbing part is the only part that can be a bit painful. You're welcome to take some kind of like oral sedative medication like a Valium before the procedure, as long as you have a ride home for after the procedure, because it's unsafe to be driving after taking medications like that. And then let's see. And there's a reminder that I was supposed to read. So as a reminder, you'll be receiving a text message, and please reply with the code word Naples, NAPLES, all in capitals, in order to be contacted for a consultation by our office. So again, let me see if there's any last questions. No, I think that's about it. So if there's no other questions, if some other questions come in, I can always answer them and contact you back with that. But otherwise, I just want to thank everybody for taking a little bit of their time on this Tuesday night, and hope it was informative, and we look forward to seeing you soon. Thank you.